well as free education and training. This is based on an asynchronous online delivery mode that helps to bridge the time zone difference and thereby provides a platform for learning opportunities to busy clinicians. The World Kidneys teaching and training programs are delivered by experienced clinicians from various reputable national and international centers to enhance exposure to a broad spectrum of clinical experience. The educational modalities include online lectures, video conferencing for interactive sessions, case-based discussions, critical appraisal of scientific papers, problem-solving exercises, and face-to-face workshops. The World Kidney Academy programs are accredited by the American Association of Continuing Medical Education or the European Accreditation Council for Continuing Medical Education. The World Kidney Academy, committed to education and training. Welcome to the World Kidney Academy. The World Kidney Academy aims to provide high quality and evidence based clinical education at an affordable cost to cover the expenses as well as free education and training. This is based on an asynchronous online delivery mode that helps to bridge the time zone difference and thereby provides a platform for learning opportunities to busy clinicians. The World Kidneys teaching and training programs are delivered by experienced clinicians from various reputable national and international centers to enhance exposure to a broad spectrum of clinical experience. The educational modalities include online lectures, video conferencing for interactive sessions, case-based discussions, critical appraisal of scientific papers, problem-solving exercises, and face-to-face workshops. The World Kidney Academy programs are accredited by the American Association of Continuing Medical Education or the European Accreditation Council for Continuing Medical Education. The World Kidney Academy, committed to education and training.
ده احنا ضحكنا حبه يعني فاطمه هتسافر امتى؟ والله كله بس يا حنان هي طب انا بقول لك انت مشغوله معانا العز ده.
Excuse me, could you Okay. Hi, everyone. Thank you for joining today. We're gonna start just now. So we have two main presentations today. The first presentation to introduce you to the exam preparation course run by the World Kidney Academy. My name is Ahmed Saleh. I'm a consultant nephrologist in the United Kingdom, precisely in Scotland. I'll be sharing with you my presentation, followed by Professor Halawa's presentation as well. Thank you very much. I'll just share my screen. Right. Can you see my screen now?
Yes, yeah. We can see it.
Perfect. Right. Just right. Thank you. Again, thank you very much for joining us today. I'm going to share with you a few slides about the exam preparation program that we are preparing in the World Kidney Academy. Again, my name is Ahmed Saleh. I'm a consultant nephrologist in the United Kingdom. So we know that the process of preparing to our exam is very challenging process. A lack of resources or sometimes too much resources, but you are drowned into it. You're not sure where to start from, what's the timeline needed, and where to start your study and how to manage your time as well. We are busy professionals. We have limited time. We have commitment to the family. So how we can arrange and how we can fit all of this into a proper time and how prepare yourself very well to an exam and achieve well as well. So as any trainee, by the end of your training, you should show that your skills and knowledge had accumulated over the years and preparing you to the exam. So we plan to help you through our course to prepare you through any form of exam that you are going to prepare for, whether that's a national or international exams, because by the end of the day, the way that these exams are prepared are all actually the same. So we have curated a perfect program in our opinion, which is a 12-week comprehensive course, plus 3 to 4 other webinars, live webinars that we are going to discuss the tips and tricks, especially related to the difficult part in the nephrology preparation. We have engaging lectures followed by extensive clinical discussions and a huge amount of questions that we curated over the last
No sound, Dr. Ahmed.
You're muted, Dr. Ahmed.
Oh, sorry. Oh, sorry. Okay, I'm going to share my notes again. All right, sorry for that. Okay, I'm not sure when that muteness had started, but anyway, I will start all over again. So
No, you can start from the curriculum, Dr. Ahmed. Curriculum of the.
All right, perfect. Okay, so as we said, we have delivery of the course will be using an excellent interactive platform that most of you already has used over the years, or the World Kidney Academy. We have a structured curriculum that I'm going to share with you in a few minutes. We have excellent videos, slides, presentations to help you to understand the topics, followed by, as I mentioned, multiple MCQs, followed by top tips, followed by other guidelines, and sharing our experience over the years and how to prepare you appropriately for an exam. So these are the outlines that I'm sharing with you at the moment. We have a 12-week course plus in phase one as 3 webinars that we are going to share. So in week 1, we have a glomerular disease. It has 3 entities within it. For detailed structure, please have a look on the handbook, please. And week 2, we have a fluid and electrolyte imbalance. Week 3 is focused on the vasculitis, and section 2 will be on hematological conditions associated with kidney problems. Week 4 is 2 main entities, which is pregnancy and kidney, and part 2 of week 4 is malignancy and kidney. Webinars will be embedded in this program that will be a live webinar. Well, the first webinar, we will be focusing on the electrolyte and acid-base balance. We know how much this is very frequent in the exams, and you need to be prepared through case discussions and MCQs and other parts that we are going to use in this webinars to help you to navigate through this difficult, challenging topic. Week 5, we are going to share with you a diverse transplantation. It will be a heavy one. Usually the transplantation have about, I would say, 15 to 20% of the exam marks on it. Sometime it might be higher. However, it will be a condensed one because we shared about 6 lectures followed by another 300 up to 400 MCQ questions within it. Week 6 is focusing on the chronic kidney disease, CKD, MBD, cardiovascular, and anemia. Week 7 will be stones, cystic disease, and rail disease as well. Week 8 is focusing mainly on the dialysis and obviously hemodialysis and peritoneal dialysis, and followed by a webinar that will be a pathology review, and we are preparing an excellent session with that. It will be, again, a lengthy session, maybe 2 to 3 hours, to revise all the pathology or that usually encountered within your preparation for any exam. Week 9, it will be just as a revision for that webinar that we just mentioned. And there are a few topics that didn't really fit with any of these. Therefore, we collated all of this as hypertension, scleroderma. That's very common in the exam, that we are putting all of this in week 10. Then we have 2 mock exams to prepare you very well for the exam. Each of these mock exam will contain 200 MCQ questions. That will give you afterward an extensive answers and the reflection of your answers. And we have another webinar of transplantation during this 12-week course. So bottom line, it's a 12-week course plus 3 webinars. Expected will be hard work, assuming that we will need at least 6 to 8, maybe up to 10 hours a week dedicated for this course. We are presuming that everyone preparing for exam will dedicate about 3 to 4 months to meet the criteria or prepare very well for their exam. Therefore, it's a very detailed course that will prepare you very well for the next step and for any exams. We have an excellent team, I have to say, led by Professor Halawa. I'm the program director, and I'm fortunate to have Dr. Rami as a consultant nephrologist, Dr. Muhammad Absattar as a consultant nephrologist, and Dr. Mahmoud Che. All of them are an excellent teacher who helped lots of training over the years to navigate through the training and as well to navigate through the exams and prepare them well. We curated, as I mentioned, an excellent program that will help you for any form of exam that you are preparing for. And we are happy to share that in the next month with you. The program will start on the 28th of September, and that will be the first run. It's self-paced, and but we'll have lots of interaction within it through the webinars and the platform as well. As I mentioned, it's open for any trainee preparing for their exams. You can admit yourself into our course if you are a junior trainee, need to understand more about nephrology, or a senior trainee preparing yourself for the exam. The cost of the exam, this course is $195, and it will give you an access for 6 months to help you revise and prepare for the exam. We prepare some discount codes as well. Feel free to use it. It will, if you are a group of 5, it will give you a 15% discount. A group of 10, it will be 25% discount. And you can, if you are just a single individual, you can use the first one, which is early 15, and it will give you 15% discount. Thank you very much for joining us today. And now I will unshare. And we'll provide, and the mic is to Professor Halawa to
Thank you very much, Dr. Ahmad. If you don't mind, can you take care of the admission? And Dr. Rami as well is a co-host. So please take care of the admission. Thank you very much. So, yeah, I mean, interesting that we talk about how to crack the MCQ. So cracking the MCQ is quite, a fine art. You need to learn how to answer the questions properly and don't fall into a trap. The MCQ, however, we used to mention is not designed to trap you, but definitely to trap people. My name is Professor Ahmad Halawa. I'm a consultant transplant surgeon, Sheffield Teaching Hospital, United Kingdom. I'm a member of the panel of examiners, Royal College of Surgeons, examining MRCS anatomy examiner. Also, I'm a member of panel of examiners of Royal College of Surgeons for the FRCS, where I examine transplantation. I'm the director of the World Kidney Academy. Cheating may expose you to unnecessary embarrassment. Not only that, it's a career-threatening situation. In this program, and also in this webinar, we're teaching you how to pass the MCQ exam without cheating. We're not teaching you science in this webinar. There is a fine art and there is a way of getting the high score of the MCQ. You need to learn it, you need to know it, and you need to practice it. If you don't mind, Dr. Ahmad and Dr. Rami, admit, colleagues. The objective of this webinar is how to score the highest mark if you studied that topic very well. I know the topic very well, but in spite of knowing the topic very well, sometimes you don't score high. You do mistakes. How to do educated guess if you have to guess some of the answers. Of course, we face this problem. Some of the answers, we don't know anything about it. How to make an educated guess means guessing in a way to come closer to the correct answer. You may hit the correct answer if you guess it properly well. Blind guess, you've been asked about a question never heard of. How can you have a feel of the correct answer? How to do blind guess. Don't mind Dr. Ahmed, Dr. Rami, admit colleagues, please. To start with, when you have the exam paper, read the instruction first. Don't rush and answer questions without reading the instruction. The instruction will provide you with a valuable information regarding how to take the test. For example, use a pencil, not a fountain pen. Time allowed, and so on. Make sure that the exam is not negatively marked if you got the wrong answer. This will appear on the instruction. Fine, I know the answer. The MCQ question came right in the heart of a topic I studied very well. Surprisingly, still you do mistakes. And we'll teach you today how to avoid these mistakes. To start with, you need to screen all questions, just eyeball all questions. You may find an easy question to answer quickly. This will save your time. Rather than starting from question number one, no, screen them, all of them together to have a feel. And to pick up the easy one, you are 100% sure of the answer. This will help to prime your brain for more challenging questions. Also, some questions may have an answer to another question. Some question may give you a hint to another question. And this is the value and the advantage of screening all questions in one go. Read the question thoroughly first before rushing into the options. We often think that we know what the question is asking before reading it and jump straight to an answer. This is an expensive mistake. Will cost us a lot. We'll lose a mark because of rushing. So read the question thoroughly first. Answer it first in your mind without looking at the options. After reading the question, think about it. Come up with an answer in your mind. Why? Because this will prevent you from drifting away from the correct answers. If you didn't do this, you will get distracted. Surely you will get distracted by the different options. There is a nice technique called elimination technique, where you eliminate the wrong answers first. So you start backwards. Even when you believe you know the right answer, first eliminate those answers you are 100% sure that they are incorrect, to ensure the answer choice is the correct one. Do you mind mute yourself? Do you mind mute yourself, please? Not only does this strategy save time, but also increases the likelihood of selecting the correct answer. So eliminate the wrong answer first. In spite of you could know the correct answer, but go for the wrong answer first and eliminate them. Then the MCQ is usually asking for the best answer. Not only the correct answer, the best correct answer. Because many answers will look correct, but which one is the most correct? Which one is the best? And this is this is what all the MCQ is about. Read every answer option. Some of the answers may seem straightforward to some, but they are not the best answer. And this is a common mistake we always do. So when you read the options, you find this is more likely better than the other options. And this is what the MCQ is all about, is the best correct answer or the best correct option. Remember, there's usually a best answer for every MCQ. If you quickly assume that you know the correct answer without first reading every answer option, you may end up by not selecting the best answer and losing mark. Answer the question you know first. As I mentioned early on, when you screen all the answers, get the easy one you know, and you are 100% sure of the answer. What about if I have a difficulty in answering one of the questions? Move on. Don't stick to it. Don't get stuck. Move on. You may find hint later on, or you may find a leading question which can lead to the answer of the challenging question. You couldn't figure out what the correct answer is. Pay attention to these words. They call it qualifying words, but they qualify you for failure, such as all, most, some, never, always, usually, more, and less. Especially all, best, only, always, never. Very suspicious words. Any answer that includes always must be impossible to deny if you know a counterexample, something against it. Then this option is wrong. The same applies for never. If you know a single counterexample, this indicates the option which contains never is wrong. For example, Mr. X never failed an exam, but you know that he failed one of the exams. So this option is wrong. The same applies for always. Mr. X always passes the exams, but you know that he has failed one of the exams. So this option is wrong. And actually, most likely, always and never come to trap you. Stick with your first choice, but not always. It is best to stick to the answer you first thought about it, you first selected after reading the question. It's not good to keep changing your answer. However, this does not mean the first choice is necessarily the correct answer, but most likely is a correct answer, but not always. MCQ are not usually designed to trick or confuse you. They are designed to test your knowledge and ability and skills. The answer options provided will often include most common wrong answer, logic, but ultimately incorrect answer, seems correct, but it's not correct, and the best answer. The examiner is after the best answer. Many questions will come with the options of all of the above and none of the above. You know, none and above, no, all of the above and none of the above, a bit tricky. Don't select all of the above if you're pretty sure that one of the answers provided is incorrect. The same applies for none of the above. If one of the options is true, so none of the above option is incorrect. There's a trick here. If you have two answers who are correct in a multiple choice question with all of the above option, most likely all of the above is the correct option, because the examiner usually is asking for one correct answer. If you have two correct answers or more than one correct answer, and you have all of the above option, most likely all of the above is the correct answer. The same applies for none of the above. Manage your time, my friend. Before you start writing the test and taking the test, look at the time allowed. You have to have a plan. Again, I'm stopping you, I'm urging you not to rush into an answer. If you have a time allowed is, let's just say an hour, 60 minutes, and you have 50 questions to answer, so make your mind it's around 1 minute for each question. But remember, not every question takes the same time. And you have 10 minutes for revision. So you have to manage your time. Don't take too much time on a single question. Move on. Move on. Try to score as much as you can fast, and then leave the challenging question needs a lot of guessing to the end. You may have a clue by answering straightforward questions. Above all, practice, practice, then practice, then practice, and practice. There is no strategy whatsoever to crack the MCQ better than practicing. Study hard, learn the technique, and practice the MCQ exams. Fine. A question came up, and I have no clue what this question is about. No idea. Even I couldn't read it properly. How can I get as much as I can out of it? How can I score some of the marks rather than losing them? I would like to remind you that all guessing techniques are not a substitute of proper test preparation. They are not 100% correct and will never guarantee 100% the pass mark if you don't study well. All guessing technique will help you with some knowledge to come closer to the correct answer, to limit your choice between one or two options. Again, we are not foolproof. So the bottom line is study, study, and practice. Fine. So we have a myth of C. I'm sure you heard about at some stage of your life and your career. If you don't know the answer, always guess C, because it is the most common correct option. It is the math. It's not true. Generally, C option as an option is not more or less than any of the other options. It could be even less. And I will show you a few examples here. Always remember that it is your best bet to eliminate choices whenever possible. But if you can't, and you must take a blind guess, then stick to one letter and run it every time. For example, if the letter is C option, then go right ahead and just make sure that you stick to this every time you do single blind guess. This will maximize, actually, this will double your chance, could be doubling your chance of scoring some marks rather than doing it randomly. This question C, this question D, next question E. No, this is not quite right. Stick to one letter, stick to one order, stick to one option. If you decide to stick with it in every blind guess, often you'll get better off rather than selecting random options. In statistics, because all this based on the statistics rather than impression or feeling. Statistics show that if the test is not randomized, such as two successive questions on the same topic following each other, this method will give you twice as many points as blind guessing would. Sticking to one option order, let's say C, D, or E, but stick to it. If the MCQ questions are randomized, one question on, let us say, IgA nephropathy, or another question on pulmonary embolism, another question on RTA and trauma. So they are randomized. Very unlikely that the next question will have the same order of the correct answer as the previous one. Unlikely to be C like the previous one if the questions are random. Option B. So what do you think about option B? Because we inherited the option C all the time. But surprisingly, in 4 option question, where the A, B, C, and D, the likelihood of B to be the correct answer is 28% compared to C, which is 25%. Slightly better. Remember, we're talking about blind guessing here. Option E, if you have 5 option questions, E most likely to be correct compared to C. You're surprised, are you? Fine. Still, I'm doing educated guess or blind guess. How can you tell this is a correct option? If you have more information in one of the options, most likely this is a correct option. Because examiners usually put an effort and write more in the correct answer rather than in the wrong one. And I will show you a few examples at the end. Positive option, most likely to be correct compared to negative one. When you have a word or a phrase or a concept never heard of, most likely this is a wrong option. And I'll give you a few examples later. When you have always or never, as I mentioned earlier on, most likely are wrong answers. Ahmed Rami, please, if you don't mind, can you admit colleagues? Look for a hint in another question. This may give you a clue. And this is the advantage of screening the questions all together in one go when you get the exam paper after reading the instructions. You will know that in question number 35 is talking, examining or discussing the same topic as 23. So, let me read both together. Maybe I have some hint here. Unrelated options, most likely is wrong. The exam question is on pulmonary embolism, and one of the options about trauma or splenectomy or something unrelated to the disease. Most likely this is wrong. It looks like the examiner is running out of options. Remember, the examiner does not put a lot of effort in the wrong answer, puts a lot of effort in the correct answer. If you have the question with values and numbers, look for the middle range, middle order option, more likely to be the correct answers. It's safer to play in the middle rather than in the extreme. Nearly similar statements, one of them most likely the correct answer. The same opposite statements, most likely one of them is the correct answer. With a bit of knowledge, you can get the correct answer and score for this question. Grammatic, spelling mistakes, most likely in one of the options, most likely this is the wrong option. This is the incorrect answer. When there's grammatic mistakes or spelling mistakes or a word never heard of. Umbrella option strategy. When one option encompasses and includes other options, this is more likely to be the correct answer. And I will show you an example. Frequency of occurrence strategy. Look for items that appear in more than one of the choices. It could be the correct answer. If you have no clue at all, and one of the options, one item in the option repeated twice or three times, most likely the correct answer is around this option. What we are talking here about guessing if you don't know the answer. Now, let's go to true and false questions. William Poundstone, actually, this is a nice book. I advise you to read. This guy actually was teaching in a book how to win the lottery. Hopefully, I'll be able to do that. I won't be giving this lecture. So William Poundstone, who investigated this subject, found that the ratio was 56% true to 44% false, rather than 50-50. It's not 50-50. And his sample size was quite massive, 2,456 questions. In other words, it's easier for the examiner to write a true statement rather than a false one. We feel comfortable in writing true statement rather than making it up and write a false one. The chance that the next answer will be different from the present one is 63%, supposed to be 50%. But in reality, it's not. It's 63%. So go through the entire test and make the answers you know before attempting to make any guess. Still, we are talking about true and false questions. Guessing always at the end, because we're playing with the statistics here. Look at the known correct answers of the items before and after the ones you don't know. So one in the middle, I don't know. The one before and the one after, I know them very well. Should the one before and the one after are different, guess true straight away for the middle one, because most likely the answer will be true. Remember, 63% chance of getting the answer true. When both neighboring answers are the same, like true and true, the one in the middle, which you don't know, most likely will be different. Guess the opposite. If false and false, the middle will be true. If true and true, the one in between will be false. Here we are. True, true, and I don't know that this question most likely will be false. True, false, most likely will be true, because we like the true answers. We like the correct answers. Finally, do not leave any answer blank unless there's negative marking. Read the instructions again. Make sure that you read the instruction properly. You have 20 to 25% chance to get the answer right. Stick to one order all the way through if you don't know the answers. Matching questions. Matching questions are often just terms and definitions. You must match the terms with their explanation. Read both lists carefully to get an idea of all options. As you start match items, look at one list and formulate an answer in your mind before searching the other list. I'll give you an example. Guess only when you are running out of time or unsure, and leave guessing to the end. If you incorrectly did some guessing early on, a correct answer will be eliminated. Mark questions you are not sure and come back to them later. Guess instead of leaving a question blank, unless you are penalized for wrong answers. You have better chance of getting points. Now, we go for example. I will just hold on for 2 minutes. Fine, so this will give you time to breathe. Let's go for examples. It's interactive. So in the chat box, please write your answer. Example number 1. Choose the correct answer regarding the Russian-Ukrainian war. You can tell this is a question you haven't heard of. You don't know anything about it. The conflict started in 2014 following Ukraine's revolution for dignity, where Russia occupied Crimea from Ukraine and supported pro-Russian separatists. The war started in 2015. This is option B. Option C, the war ended 2022. Option D, China supported Ukraine by sending troops. Option A, the war involved Semitism. Choose the correct answer.
The answers in the chat box is between A and E, with more around A, I would say.
Do you mind, Ahmed, admit a lot of...
Yeah, all admitted, it's just a lag. All admitted.
Yeah. Okay. Yes, the answer, correct answer is A. Let's just analyze this question. How did you come to this conclusion? Most likely, I'll give you the clue in the lecture. So, A is a long sentence. Probably it is a correct answer. More explanation. You can see on the right-hand side of the slide. Actually, the war started 2022 rather than ended. So we'll do elimination technique. We'll eliminate the wrong answers because I don't know anything about Ukrainian war. But I know it hasn't ended yet. It's still killing each other. So eliminate this. China did not support Ukraine by sending troops. Yeah. Actually, China didn't say anything. If you notice in option E, the war involves. The war involves. So there's a grammatic mistake here. And Semitism, I have no idea about Semitism. I have no clue. Most likely, this is the wrong option. So we're left with option A to be the correct answer. Example number 2. Choose a correct answer regarding the Chinese civilization. Weird, isn't it? Chinese civilization first emerged in the Yellow River Valley. China maintains a rich diversity of ethnic and linguistic people group. The predominant language is Standard Chinese, which is based on Beijing dialect. China was first united under a single emperor state by Qin Shi Huang in 2021 BCE. All of the above.
Most of the answer in the chat box are E, or all of the answer is E.
Yeah. True. Based on the following. To be honest, do you think the examiner will know China and Chinese very well? So there must be some emphasis on the correct answer. To be honest, I spotted many correct answers. So more than one correct answer. So all of the above must be the correct one. So E, don't forget E is the 5th option in 5-option question. So most likely, again, E to be the correct one. Example number 3. One of the following statement is not true. According to the 2021 census data, 82% of people in England and Wales are white, 18% belong to a Black, Asian, mixed, or other ethnic group. English is the spoken language in the UK. The Welsh language was never being practiced since the Civil War. The United Kingdom is an island nation in the northwest of Europe, consisting of England, Scotland, Wales, Northern Ireland. The United Kingdom is a diverse country with many different cultures from all over the world. The correct answer is
In the chat box, most of the answers are C.
yeah, but there is A here.
Started 1A.
C. Yeah. Very impressed. Very impressed. Yes, the correct answer is C. Why? To start with, read the exam question carefully. We ask you about not true. So we need to select the incorrect answer, which will be the correct option. The examiner is asking for one not true answer. You can see more explanation in A, D, and E. So most likely they are correct statements, and the examiner is not asking for the correct statements, he's asking for the incorrect statements. B is a straightforward elimination because, in England, they speak English. It's common sense. The word never in option C, again, makes me think that this is the selected option the examiner is asking for. Example number 4. One or more of the following statements are incorrect regarding symptoms of DVT. Throbbing pain in the affected leg always affects the deep veins in the pelvis, is never associated with swelling, warm skin around the painful area, red and dark skin around the painful area. This may be harder to see in brown or black skin. The correct answer
It's between
is
C,
just a second.
but
It's a trap here. Yeah, we asking for more than, it could be more than one correct answer. Yes.
yeah, most of the team are choosing between B and C.
Yeah. Always, again. Anyway, we'll see the explanation. And never. Both came together. So read the exam question properly. They're asking for the incorrect answer. I'm playing with words. On one exam question, not true, other question, incorrect, or correct, or true answer. So I have to read the exam question carefully. Keep in mind that more than one option is needed. You spotted always, you spotted never. Most likely, the wrong answers means the correct choices. Elimination will get you to the correct answer, which is B and C. Example number 5. One or more of the following statements is or are incorrect regarding pulmonary embolism. Presents with sudden onset of shortness of breath, associated with chest pain, associated with hemoptysis, S1Q3T3 pattern is 100% sensitive, CT pulmonary angiogram is only 7% sensitive. Correct answers?
The participants are choosing D and E. If you choose
Muhammad
only
Ismail,
D,
Muhammad Ismail, remember, there could be more than one option. D and E. Fine. I need to know on what basis you selected D and E. Extreme values. Well done. Well done. Yes, true. Yeah. Look, nothing 100% in life except we die. CT pulmonary angiogram is 7%. It's too low. The CT angiogram always talking about, it's very sensitive test, and always talking about 80 and above. So extreme values, most likely both are wrong. Yeah, D and E. Example number 6. The average number of volcanic eruptions reported annually, 450, 400, 50, 15, 20. The correct answer is A lot of C's. Why? E. Mid number. Fatima. Blind guess. Of course, blind guess. I have no clue about the number of volcanic eruptions. Has to be blind guess. C. Do you think the examiner is asking for more than 2 answers? Do you think it could be C and D, B and C, A and D? What do you think? Why? Excellent, Hamza. Yes, the average usually comes with one number, not a range. So this is why the examiner didn't ask choose one or more of the of the correct statements. No, I didn't say that. So it's common sense. To be honest, I don't know the answer. But of course, I will eliminate extreme. 15 is too low. 450, 400 is too much, too many. So it will be between 50 and 20. The advantage of this technique is I limited the guess to 2 options only rather than having 5 options. I have to guess in between them. So increasing the chance of getting the score right 50% rather than 20% in 5 options question. Correct answer is C. But remember, the 50 could be here, could be in E option or in D option or in A option. Could be in any order. Example number 7. Choose the correct answer regarding ECG finding in acute coronary syndrome. Is never associated with T wave inversion. Bedside echo is not useful. ST segment elevation more equivalent or more than 5 millimeter. New T wave inversion equal or more than 2 millimeter in more than 2 continuous leads. All of the above. E, C, C, D, C, E, D, all over the place. But the good thing, actually, none of you selected A. Yeah. Because the word never. And none of you selected B. This is a good thing. So it looks like you limited the option into 3. Of course, if the word never there and it doesn't make sense as well, the option. So all of the above is wrong. D. Yeah. D. Fine. Let us analyze it in depth. The examiner is asking for one correct answer. In option A, there's the word never, so most likely is wrong answer. Therefore, all of the above was also wrong. Elimination will get C out straight away because ST segment elevation is wrong. It should be depression. Have you noticed that two opposing statements here? Acute coronary syndrome is never associated with T wave inversion. And in option D, new T wave inversion more than whatever. And I already knew that option A is the wrong option, so it must be option D. B is a negative statement, not useful. Who said that? This doesn't make sense. It's common sense. Yeah. So even there is a technique of blind guessing. Example number 8. True and false. The Berlin Wall came down in 1987. I have no idea about Berlin Wall. Even I'm not interested. What do you think? The correct answer is yeah. A. Remember, it's never been 50-50 in true and false questions. More likely to be true rather than false. Example number 9. Choose the correct answer regarding the World War II, Second World War. Begun in 1st of September 1939 when Germany invaded Poland. The UK and France declared war on Germany on 3rd of October. Germany controlled much of continental Europe, most of Africa, and many parts of South Asia. Very close to 100,000 people died in the war. Airstrikes affected mainland Europe, but rarely affected Britain. So the correct answer? A. To be honest, I will be guessing between A and B. There is a trap here. Let us have option C. It's a long sentence and more explanation, but full of rubbish. Germany didn't go to West Africa or even Asia. Option D, very close to 100,000 died. I know that there are millions. And airstrikes affected mainland Europe, but really affected Britain. Really? No. We know that London been hit. So I will be guessing between A and B, and A is the correct answer. So you have 50% now, you have 50% chance of getting it right by elimination and applying the rules I already mentioned. Example number 10. Please choose the correct statement regarding the recent Gaza-Israeli war. We are diving into a deep water now, so be careful. Condemned by the international community. It started on the 7th October 2023. The international community supports Israel. The Arab countries support the Palestinian. The West Bank is involved in the conflict. B and C, B and C, D. Let's apply common sense here. Correct answer is B. But let us analyze the options. We thought they are the wrong options. Number one, he's asking for one correct answer. So we need the best answer rather than the correct answer. If you look at the statements, all of them are vague. And in reality, not 100% true, despite the fact they may look correct. Yeah, condemned by the international community. Do you think all the international community condemned the Gaza-Israeli war? No. The international community supports Israel. Do you think all communities supported Israel? No. Some of them, but some did. Arab countries support Palestinian. Do you think all the Arab countries supported Palestinian? No. So vague statements here. The West Bank is involved in the conflict. Of course not. So we'll end up by, even if you don't know the 7th of October, because we know it very well, but if you don't know, most likely this will be the correct one, because the other statements are vague and not 100% true. And they're looking for the best correct answer, two together. Example number 11. Choose the incorrect statement regarding the Japanese language. Who knows Japanese? Who has been in Japan before? I'm sure none of us. But you can make it up. It consists of ideogram and phonogram. More than 124 million people speak the language. It's spoken exclusively in Japan. The accent is a pitch accent, written vertically. So the correct answer is remember, we ask the correct option. We asking for the incorrect statement. E. Actually, we know that the Japanese language is written vertically. Common knowledge. I don't speak Japanese, but there is a trick here. There is an emphasis here. Where is the emphasis? Exclusively. Excellent, Ali Fikri. Yes. Well done. Look, ideogram and phonogram, I have no idea, but looks like they are related to the language. Let's see the explanation. Yes, see option. what we have to do here, what's called backward elimination. The word ideogram and phonogram could refer to writing and speaking the language. So it could be the correct answer, so the incorrect option. The examiner must have put some emphasis on the wrong answer, and he doesn't know the language. The word exclusively will give you a clue. Example number 12. Choose one correct answer regarding reduction of your anxiety during exam. Practicing relaxation techniques, deep breathing, muscle relaxation techniques, close your eyes, imagining a positive outcome. The correct answer is fine. So give me the rationale of choosing your answer. Hamza, too close answer because thinking positive gives stimulation. Well, Hamza, we are after one answer, one correct answer. So it can't be A and C. Okay. Well, I mean, yeah, this is a trick. The correct answer is A. And I will tell you why in a minute. Because A option, remember the umbrella option strategy? This is the umbrella option strategy. A encompasses and includes all other options. And the examiner is asking one correct answer. So it must be A, the correct answer. Because practicing relaxation technique involves deep breathing, muscle relaxation, close your eyes, imagining a positive outcome. All in one option, which is practicing relaxation technique. Example number 13. The following languages are spoken in Comoro Islands. I have no idea where is Comoro Island, and I don't care the language is spoken there, but I have to answer the questions. Spanish and Arabic, Spanish and French, German and Italian, French and English, Russian and Swahili. So the correct answer is repeat Arabic. Yes. What else is repeated here? Who's scratching the screen, guys? Please stop doing it. A or B. It has to be one option. Look, if you look here, frequency of happening. Arabic repeated twice. French repeated twice. So it must be an option which includes Arabic and French. Yes. Option B. Frequency of occurrence. So since French and Arabic are repeated twice, B is the most likely the correct option. Example number 14. I'm not far of finishing now. Match the two columns. Column on the left, diabetes, cardiovascular disease, smoking, peripheral vascular disease, obesity. Column on the right, type 1, type 2 diabetes, MI and stroke. The commonest cause of renal failure, the leading cause of death globally, lung cancer. How do you answer this question? Number one, you shouldn't follow the order at all. Choose the options you are 100% sure of and leave guessing to the end. You may not need to do any guessing because you will be left with the correct option. So, smoking, I know smoking can cause lung cancer. Obesity, of course, related to type 2 diabetes. Cardiovascular disease, I know is a leading cause of death globally. So I left with peripheral vascular disease and stroke and MI. However, could be cardiovascular disease can cause, is MI and stroke related? Cardiovascular disease could be related to type 2 diabetes. When I started with the options, I'm sure, well, my guessing was limited and chances of scoring would be high. Diabetes and commonest cause of renal failure, peripheral vascular disease, and MI and stroke. Fine. Let's apply this to the next question. This is renal, unfortunately. Sorry about that. Match the two columns, tubulitis, BK virus infection, CMV, renal artery stenosis, PLT in one column. In the other column, B-cell lymphoma, Tardas parvus, T-cell mediated rejection, ureteric stricture, owl eyes. We'll apply the same rule. Because here, CMV can cause as well T-cell mediated rejection. And I have no clue what Tardas parvus means. Of course I know, but if I don't know. So I will start CMV, yes, owl eyes. Owl eyes, this is inclusion bodies with CMV infection. So I scored this, good. PTLD, I know it's B-cell lymphoma. It's not T-cell. Or 85% B-cell, so commonly B-cell, so it's B-cell lymphoma. BK virus infection. Yes, ureteric stricture, this is the only thing in this column which can cause ureteric stricture. Tubulitis, T-cell mediated rejection. Then renal artery stenosis, so I managed to get the Tardas parvus with renal artery stenosis. And this is definitely a duplex finding in severe renal artery stenosis, where the flow is damped. So in matching question, don't follow the order, answer the question You are sure about them first. Leave guessing to the end. If you guess incorrectly at the beginning, you eliminate a letter match and you lose mark. References, and this lecture is already recorded. We'll send the link to you. Thank you. Any questions?
Thank you, Prof. Ahmad. Thank you. If you have any questions, please put it in the chat or raise your hand and I can unmute you if you wish. Thank you, Prof. Halawa, for the excellent presentation. I truly enjoyed myself listening to it. It's an eye-opener. Thank you very much. Any questions? You can put in the chat or raise your hands and I can unmute yourself. Lots of thank you in the chat for you, Prophet Halawa.
Well, thank you very much. Thank you. And thank you for joining us today. And hopefully you have learned the rules of MCQ, which is study hard and practice fast, rather than, being smart and try to do guessing. Guessing not always accurate, is not infallible. There's no guarantee to score high with guessing, but it helps in reducing the options you choose from. Thank you for your time, and thank you, Dr. Ahmad. Looking forward to see you, my friends. Thank you.
Thank you. Perfect. Right. Then we'll wrap up and finish for today. Thank you all for joining us on Friday, and see you later. Thank you. Bye.
Bye. Thank you.